It was supposed to be the season of joy, a post-pandemic festive season, one that brought people together. Instead, it is the season of a new variant, one that is wreaking havoc across the world. For the first time since the pandemic began almost 2 years ago, the number of daily new COVID-19 cases crossed 1 million worldwide. The pandemic has dampened plans for New Year's Eve celebrations for a second consecutive year as countries impose restrictions. Numerous nations registered all-time highs in just the last 24 hours, including Argentina, Australia, Bolivia, the United States, France, Italy. In Europe, traditional concerts and fireworks were cancelled in most major cities, including London, Paris, Brussels and Rome. Cancelled bookings in Spain's capital cost the hospitality industry over 350 million euros. That is 3% of the annual revenues. In Italy, restaurant and club owners called for urgent government support, with 25 to 30% of the New Year's Eve dinner bookings standing cancelled. In Greece, there is a ban on music at all commercial venues, and new restrictions include earlier closing times for restaurants.
Όπως καταλαβαίνετε, όταν συμπτήσετε το ωράριο, συμπτήσονται μετά και τα μεροκάματα, τα ημερομήθεια, η μισθή. Ένα μαγαζί συντηρεί οικογένειες, συντηρεί ανθρώπους. Όσο εμείς σαν ιδιοκτήτες να ζητήσουμε υπομονή από το προσωπικό μέχρι να ανέβει η δουλειά παραπάνω, όπως καταλαβαίνετε ότι με υπομονή δεν πληρώνονται ενοίκια και δεν ζουν οικογένειες.
In Paris, wearing masks outdoors is compulsory once again. France is mulling a 50,000 euro fine for companies that are not following work-from-home guidelines. In the Chinese city of Xi'an, residents are running out of food. Citizens say they are struggling to find enough food despite Beijing insisting that there is adequate supply. This is a city of 13 million people in central China. It has been in lockdown since last week in an effort to stamp out an increase in COVID-19 infections. In Indonesia's resort island of Bali, foreign tourists have been warned by the authorities they may be deported if they are caught violating rules during New Year's celebrations. Mexico City has also cancelled its massive New Year's Eve celebrations as a preventive measure after a rise in COVID-19 infections. In Saudi Arabia, authorities reimpose social distancing measures at the Grand Mosque in the holy city of Mecca. This comes after the kingdom recorded the highest number of cases in months. And with us on the broadcast is the National Chair of South Africa's Medical Association, Dr. Angelique Coetzee. She is also one of the first doctors in South Africa to treat Omicron patients. Thanks very much for being here with us, Dr. Coetzee. If you can start by giving us a sense of the situation on the ground in South Africa and the hospitalization rates at this point.
Good afternoon from South Africa. I know it's evening at your place, but luckily the sun is still shining here. So we see since the 25th of December that our infectivity rate stays between about 23 up until about 27-28%. Our cases are not very high. On the 25th of December, 14,828 people out of 57,643 tested positive. We had 80 people that was hospitalized and 30 deaths. If we look at the data that was released yesterday for the 28th, it was 9,020 people positive out of 34,000 people tested, 81 deaths. And the day before it was 7,260 out of, again, 30,529. Our hospitalization is more or less round about, very stable, round about 500 to 600 people at hospitals currently. If we look at the people currently ventilated, on the 27th, it was 289 across 600 facilities. 666 facilities. On the 21st, if we compare the two dates, it was 229 and ICU on the 28th was 661, and on the 21st, 566. So, again, this is, as I have said, over 666 facilities. It's very stable. It doesn't really go up. It sort of stays the same. We will see 2 weeks after New Year starts what our numbers will do then. If it's still low or still very much stable, then I think we are over the worst. But we will have to see as the schools will then reopen and see what happens then with infection rates, if it's going to go up again. And then we still haven't had any further lockdown restrictions. We still stay with the same restrictions, and we have started this week for the first time with boosters for the public. They can either get Johnson & Johnson or Pfizer. For now, we're not mix and match yet, but we hope to start a mix and match sometime in the new year.
Right. You are one of the first doctors in the country to treat Omicron patients. Tell us about the symptoms you have noticed so far. How long before we could conclusively know about the Omicron variant in terms of its severity?
Well, I think we are now, today is actually 7 weeks ago that I saw the first case, and I think we know what is the severity. We know that the majority of cases are very mild. There's a study just released by Prof. Glenda Gray, and it still needs to be peer-reviewed, and her colleagues, where they make it very clear in that study that if you look at severity of disease, it's normally about your T cell and your memory cells, how good they can protect you. And the study just, as I said, still need to be peer-reviewed, showed that between 70 to 80% of the CD4 and CD8 T cell response to the spike proteins was maintained throughout. And the conclusion that you can come to that is that no matter how extensive the mutations of the Omicron are, the majority of the T cell immunity, whether it's induced by your natural immunity, whether it's induced by vaccines or a combination, seems to be protective against severe disease. We know that a lot of South Africans had, maybe contact with Delta before. We had a severe Delta wave. We also know that about 44% of our adult population is vaccinated. It's not a great number, not the same than in Europe. So if we look at the severity, then again, we know that in the hospitals, the majority of patients, 88%, is unvaccinated. The vaccines, again, as we have seen, the T cells are supposed to protect you. So yes, there will be the 12% in ICU that's been vaccinated should actually be able to get through the ICU, and with ventilation should do actually very good. But for that, we still need time. Normally, we know that ICU cases take anything to 4 weeks. But again, the majority of people got mild disease, so that there's no need to wonder if it is a mild disease for the majority of people. Yes, it is a mild disease for the majority of people. For 88% of people, it is, or for 80-90% of people, it's a mild disease. Again, the symptoms are very easy symptoms. It's musculoskeletal. Patient will tell you, doctor, I was fine yesterday when I went to bed. During the night, I felt hot and cold. Wake up with a headache or a body ache and pain or a chest pain or a backache, with this type of tiredness that you see if you get flu. And they might have a tiny bit of a scratchy throat or a bit of a cough. And that's the symptoms, and you need to treat them as quickly as possible. Put them on cortisone. Don't wait. With Delta, we waited, and that's correct. And Delta had other symptoms. And the recovery rate for the majority of people in the primary healthcare is between 5 to maximum 7 days. So that's where we are. It's still nothing changed.
Right. How concerned are you about the transmissibility of the Omicron variant?
Well, it's very transmissible. We have made peace with that. It's there. There's nothing, you need to accept it. So, but by accepting it, you need to then say, okay, what measurements should be put in place? And we stick to the same measurements the whole time. You see, the thing is, we want to make this very complicated, and we should not. The treatment lies in the prevention, and that lies in the simplicity. And again, it's the why do I need to wear a mask? Masks should be compulsory, and this is one of the things that a lot of the other countries didn't do anymore. And South Africa, we were quite adamant about the masks, and even when it was not compulsory, people still wear their masks. And a lot of shopping centres, you would not go in without the mask. They will really ask you to leave. And now it's just been more enforced, and I'm very happy with that. And then we need to empower the people again. What is the symptoms? What do you need to do if you think you've got Omicron? Doctor, what do you need to do? Do you need to give antibiotics? No, please don't give antibiotics. Then the other thing is, do I need to get vaccinated? Will the vaccines protect me? Yes, it will protect you. We have now seen, especially with the study, that your T cells are they keep the memory, and will protect you greatly against severely disease. No, will you get mild disease? Yes, you get mild disease. You get breakthrough infections. Don't even worry. You're going to see that. But are you going to be mild? It's supposed to be mild. Except if you don't listen to what we're saying. If we say mild disease, it means that I can treat you out of hospital. It doesn't mean to say you're not going to be sick. You're not going to feel awful for 2 or 3 days. That's not what we say. And if you are severely overweight with diabetes and high blood, uncontrolled, and you get up in the morning, you get this feeling that your body is sore, you're a bit tired, you're not sure, you were fine yesterday, go and see your doctor. You need to be getting onto cortisone ASAP if it is suitable for you to take.
Dr. Coetzee, appreciate very much for joining us on the broadcast with those inputs. Thanks very much.
Thank you so much, and please stay safe.
You too. Thanks very much. WION now available in your country. Download the app now. Get all the news on the move.